Welcome back, Focus Learners, to another explainer. Today, we are decoding exactly how to choose the right medical billing and coding study program. If you're ready to jump into this field, you've probably noticed there's a whole sea of educational options out there. But how do you actually know which one is the right fit for you? Well, it's not just about picking a school at random. It's honestly about reverse engineering your entire career path. So let's dive right into this and make sense of the journey ahead.
Here is our roadmap for today's explainer. We'll be looking at aligning your career goals, curriculum focus, the actual time commitment, essential prerequisites, and finally, applied math and billing. Let's get to it. Section 1. Aligning with career goals. Our source material hits the nail on the head right out of the gate. It says, a program that prepares you for a certification test that doesn't align with how you want to spend the remainder of your career is the last thing you want to do. Makes total sense, right? Before you even think about enrolling anywhere, you have to picture your long-term job environment. Are you seeing yourself in a fast-paced, bustling hospital? Or maybe a quieter, highly specialized doctor's office? That end goal destination literally dictates exactly where your starting point needs to be.
You've really got to weigh those career needs against your educational options. For instance, you might hit up a community college for a 2-year associate degree, which, by the way, absolutely boosts your marketability. Or you might look into shorter certificate programs, which are super viable for getting your foot in the door faster. But, quick side note here, and this is crucial, a certificate of completion from a school is not the same thing as being certified. Genuine professional certification, that only happens later, after you finished your studies and actually passed the rigorous credentialing exams.
Moving on to Section 2, Curriculum Focus, AAPC versus AHMA. So what you study is going to look radically different depending on whether you lean toward AAPC or AHIMA. AAPC, the American Academy of Professional Coders, is definitely a route if you want to work in physician-based billing. Their whole training setup covers a ton of ground on CPT codes, which are the current procedural terminology codes used in doctors' offices. On the flip side, we have AHIMA, the American Health Information Management Association. They are the absolute heavy hitters for hospital environments. Their curriculum dives deep into ICD-9 Volume 3 procedure codes, which you specifically need for invoicing hospital inpatient services.
Now, does this mean an AAPC coder is banned from hospitals? Or an AHIMA coder can't work for a family doctor? No way, absolutely not. Crossing over is totally possible. But, and this is a big warning from the source material, if you have a mismatched certification, your initial learning curve on the job is going to be incredibly steep. Your exams just won't be focused on the specific stuff you're doing day to day. To make your life a whole lot easier, pick the curriculum that perfectly aligns with your dream workplace from day one.
All right, Section 3, the real-time commitment.
The bright side of medical coding is that you aren't staring down a 10-year medical school residency. However, you should definitely plan on dedicating about 1 to 2 years to formal schooling, and honestly, that usually demands a commitment of around 30 hours a week of studying. But that's really just phase 1. After you finally snag that certification, you've got to gear up for about 2 more years of super critical post-certification on-the-job training.
Also, keep in mind that how long you actually spend in school heavily depends on your baseline skill level. Like, if you're already working in healthcare, you might breeze right through. But if you have zero computer experience, or maybe your English and math skills have gotten a little rusty over the years, well, you're absolutely going to need more time in the classroom to lock down those fundamentals. It's really all about being realistic with the time you truly have available to commit.
Which brings us to Section 4, Essential Building Block Prerequisites.
Let's dive into these foundational skills. You might be surprised to hear that you don't need to know all the ins and outs of the medical industry before you enroll. But you absolutely must have these core building blocks ready to go. Medical coding means processing incredibly complex documents and doing it fast. That means a rapid reading speed, top-notch reading comprehension, and super precise, fast keyboarding are just non-negotiable. And yep, core arithmetic is on that list too, which we're going to break down in just a second.
A question that pops up all the time is, wait, do I need a high school diploma to even start? Well, the answer kind of depends on your path. To take the baseline entry-level exams for AHIMA, yes, a high school diploma or an equivalent is strictly required. AAPC, interestingly enough, doesn't officially demand it for their basic certificates, though they definitely highly urge candidates to have one. But here's the really good news. Pretty much anyone can start a training program, whether you just graduated high school or you've been a stay-at-home parent for years, and begin building up these exact skills.
And finally, Section 5, Applied Math and Billing. Let's demystify a really important concept, the RVU, or Relative Value Unit.
Ever wonder why CPT codes have specific dollar amounts attached to them? It's all because of RVUs. Medicare and a lot of HMOs use this foundational number to figure out what a medical service actually costs. It's basically calculated by mashing up three things: the physician's time and expertise, the operating costs like rent and supplies, and the provider's malpractice liability costs. It's like a giant formula that keeps the lights on.
And this is exactly why your core math skills are going to be used every single day. To figure out the actual reimbursement rate, a coder has to take that RVU we just talked about and multiply it by a geographical conversion factor. I mean, think about it. It obviously costs way more to run a medical practice in a major metropolitan city than it does in a rural farm town. So you'll be constantly using addition, subtraction, and multiplication to run these critical reimbursement formulas.
And it doesn't stop at RVUs and conversion factors. Coders also have to be completely comfortable working with fractions and decimals. Why? Because you'll need them to pinpoint the exact HCPCS codes. That's the Healthcare Common Procedure Coding System, specifically for drug injectables and specialized medications, where the dosages are almost never perfectly round numbers. If the thought of all this math is making you sweat a little, don't worry. Our source material actually highly recommends chatting with an admissions advisor about taking a quick math refresher class at your local community college before diving in.
So, what's the big takeaway from all this? Choosing your program isn't just some random search, it's a highly strategic decision. It's based on where you want to end up working, how much time you can realistically give, and making sure your foundational skills are rock solid. Are you ready to put in the hours and master the math to become that crucial link between healthcare providers and their revenue? Please like, share, and subscribe to Decode Healthcare with Harshal.